flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And since I wasn't here for the meeting, somebody was here for the meeting to approve the minutes of the last Senate meeting. You guys did approve the minutes of the special meeting at the last meeting, correct?
Yes, yes.
I'll move to approve the minutes from the March meeting.
So approved. So, I have organizational issues as a 10-minute agenda item. Since we are pretty short-handed, and since at the last meeting, the new person in the room, Jenny Lesage from the school district, was already introduced, I don't really have any other organizational issues. Anybody else have any organizational issues? The only organizational issue was getting organized to have the meeting, I think. From there, I will go to the health officer's report, which Kevin sent in. Lisa, would you like to read it into the record, or should I? Okay. So after much anticipation, this is from Kevin Kachansky. The date is 4/18. It's the an inter-office memorandum serving as the health officer's report. After much anticipation, the Delaware County Health Department has commenced operations effective April 2nd, 2022. In part, this will include the issuance of licenses and inspections for all food establishments, temporary food events, mobile food vendors, and public bathing facilities within Radnor Township, as well as all calls and complaints associated with these facilities. Moving forward, the township is no longer responsible to provide these services. As such, the township will no longer be utilizing Barry Issett and Associates for health-related inspections or plan reviews. The summary of actions completed during the month of March is that 8 facilities were inspected, and the staff reviewed 2 new applications for food licenses, and that is the extent of the report. Questions, comments, concerns?
The only comment I'll make briefly is if anybody wants to look up inspections that are being done in Radnor now, it is still on the same website through the state, which is pafoodsafety.pa.gov, except now you will no longer be looking under Radnor Township as the jurisdiction. You'll be looking under Delaware County Health Department as the jurisdiction. So if anyone is interested in looking up those reports, just make sure you're not looking under Radnor Township anymore. You're now looking under Delaware County Health Department.
Now, when you go to Delaware County Health Department, is it a unitary report, or is it broken down into townships?
You can break down the search by city, but when you jurisdiction, it means which department versus there's a separate line for city. So you can break it down by results for the different mailing addresses within Radnor.
But you don't get it agglomerated as Radnor. You would have to go to Wayne and Villanova and
yes, Wayne, Villanova,
St. David's,
Bryn Mawr.
Is part of Bryn Mawr in the town?
Yeah.
Part of it is,
Huh.
And
Okay.
Radnor.
So, are there any other implications for us at this point of the go live of the county system? Anybody aware? No. Okay. All right. So, with that, I think we should move to old business. And Maggie was here for a 5:30 meeting, God bless her, and we're having a 6:30 meeting, and she couldn't make the 6:30. I did have a brief interaction with her, and first I had thanks from several of the board members for the support that of the Board of Commissioners members for the support that the Board of Health provided over the township issue, and I think everybody saw that the township created ordinances that essentially precluded the operation of the current site because of its distance from border of property to border of property not falling within the mandated 1,000 foot distance. I think there continue.
So David, hang on, that ordinance did get passed?
Yes,
Okay, thank you.
it did. I would like a more, so at next meeting, we'll ask Maggie for a more formal report so that the full details are entered into our minutes. But I believe that there continue to be permitting issues as well with that site, and the site appears to be completely dark at this point. So I think for the benefit of those citizens who were highly concerned about the potential adverse effects of said business, and more specifically, I think the practices of said business, I think that this is a good thing for the citizens of the township. What I haven't seen or heard, and I think this tumbles into Jenny Lesage's purview, is do we as a township feel that in the two separate issues where is there a need for public education, and one is the relatively novel, at least to me and to many of the people, the relatively novel compounds of concern, Kratom and Delta 8. Do we need a public education campaign, and who would undertake to do that, and where would the resources come from? And then the second greater issue is with a county-based Board of Health, I think addiction services and issues will flow from state through county and belong at the county level. But do we in Radnor Township have a need for something ourselves in terms of education or surveillance around general substance abuse and addictions? And I raise that as a question for something for us to think about. It was included in our report that that we are fortunate but can't assume that good fortune lasts, and is there something that we need to do? And I think that's a topic that we should keep a finger on, and I think that one of the places that it might first show up would be at the schools. And so I think that simply awareness and surveillance for now, but do we need to consider, is there something more that we should do working with the Board of Commissioners? Anybody else have a comment in that regard?
Wasn't sure if I was supposed to talk or not. So basically, at our high school and through the middle school, we have always had someone from Karen Foundation that works with our cessation and our drug and alcohol awareness, and works with any of our students that would come to us through the SAP process, the Student Assistance Program, where we would locate students either through referrals from other students, from parents, from staff members, and take it through a group in our high school and middle school that look at students, look at the concerns that are brought up, and make a plan with that particular student. But the Karen Foundation provides us a staff member and has she has worked with us for as long as I've been here, which is 2014. I don't know how many years she was here before that, but she is very well liked. She's very good at her job and has worked with our students for years based on that. Now, this exact thing that you're talking about, you know, I don't know that we have any specific programming, literature, or anything about those two substances that you just mentioned.
To paraphrase, you sounds like the school has a fairly robust surveillance from the point of view of resources for circumstances where individuals may be involved. Is that what you were telling me with this Karen Foundation surveying?
Absolutely correct.
So the question that I'll then keep open to bring back to the Board of Commissioners is, do we have a need in this township for providing some kind of of education to the public in general around the compounds that were of such great concern when a new business was essentially opened, and making them much more, if not available, because they're pretty available. You don't have to go far to get them, and you don't have to go far from your internet to get them. But
You're right.
in the face of the public of Radnor, and I think we really need to loop the Board of Commissioners back in there.
I guess my only comment would be that in my research about Kratom, what I found that the average user is males in their early 30s. So would this group be the most at risk that needs to be addressed? I don't know.
Okay.
My suggestion is it wouldn't hurt to get a speaker in, at least to give a presentation to us, a more formal presentation. I'm sure we can find a resource from any of the people that spoke or in the township that can come here and give us, so we can understand it better than just our brief meeting. That's be my suggestion. Then that will be at least taped for the township, and then take it from there. Because the school sounds like they already have resources available. That's Radnor Township, but we have this whole population here that probably would like to know too.
Jenny, do you think it would be possible that maybe this person from Karen, who the township has a relationship with, perhaps that's a possibility as a speaker?
I could definitely ask if they could come in. I think one of the things is I'm not sure just how well-versed she is in exactly what it is you're speaking about. And I know it's not something that has been brought specifically to my attention, that this is something that is, really prevalent or known to be prevalent in our buildings, in our school district. So, I'm not sure she would be the person, but I can always talk with them and see if they have somebody or know somebody that does have information regarding those two compounds.
So can we, because I would not know how exactly to identify and whether or not people are willing to do such voluntarily. I think it's a great idea, Kathy, to fold that into our proceedings. And maybe an action item for you would be to ask your Karen Foundation representative if they have a suggestion. If anybody else has a specific suggestion, I think that that would be great.
Well, probably Kiki would have one, but we'd have to ask her. She's not here. I'm sure she would know somebody too.
Okay, so.
Let's reach out on both ends and see what we come up with. Yep.
That's great.
I would say that if we're looking for a speaker, I could probably canvass the community where I work and see if I can find somebody that could speak to the group. Some pretty knowledgeable people that are pretty well-known in drug and alcohol abuse.
We have three opportunities to figure out, and maybe we might end up with three different folks. That would not be the worst thing in the world. Okay?
Sorry, the only other thing I'll fold into this, because it was a point that came up during the emergency meeting, or was about, and it's kind of related to what Joan just said about the population that is at risk for this, is now we do have representation from our school district here. Do we want to take a look at representation from some of the local colleges? Because they are part of our community too, and we do have 4 of them in our community. I mean, it's a pretty significant chunk of our population in Radnor. Whether that looks like a liaison, or I don't know what that looks like, but if we want to figure out a way to include them more in what we're doing here.
So I actually think that's a fascinating suggestion, completely reasonable and rational. Belongs under new business, but let's take it up.
Okay.
Because.
I mean, that's sort of more of a vague suggestion and a
Yes.
longer term
So I
project, probably.
Yeah, I think it is a long-term project. When I see how long it took us to have a completely
Right.
cooperating in township
Yeah.
board, how long it took to get Jenny on board, and we're thrilled to have you. And the notion that how would it, I mean, we have multiple substantially sized institutions. And yes, they represent, whether it's resident population or not, trampling through the streets of Radnor. We have lots and lots of people, and that's a really interesting suggestion. I don't know how to begin to tackle it, but I think that we should take that up as a notion. Maybe people, I don't know that we're going to get anywhere batting it around here, but we should start to think of ideas as to how we might bring representation of the institutions of higher learning into this. Because let's be frank, one of the biggest agencies early in the pandemic with regard to specific rules, regulations, and risk to the local population was Villanova University. And we did end up with reports in from, so I think we all need to maybe give that a little bit of thought and figure out how we might be able to do that. That makes a lot of sense to me. Anybody else? Great. Next agenda item falls to you, Joan, a follow-up on animal health ordinances.
It's the animal health ordinance. My version has now been submitted to the township last month. And the next step was that it would go to the solicitor, which I believe that's where it still is. I'm waiting on hearing back on exactly where with the progress. So I'm waiting to hear back from Bill Gallagher on the progress as Bill and I are working together on it. And then after that, it goes to the Board of Commissioners.
Great. So status is pretty much status quo. Hopefully we can get that off of our monthly agenda by the end of this school year, and your yeoman's work can be rewarded with completion. Thanks. So the next item is also yours. The follow-up on road safety.
Yeah, I don't have any updates. There was a meeting with the police department about 2 months ago, and the next steps I'm waiting on.
So we'll loop back
With
PD.
Yeah,
Okay, great.
and the liaison is Bill Gallagher.
Wonderful, thanks. So should we try and get Bill to join us at our next meeting?
I think that's a great idea.
Okay, try and get him on the agenda for our next meeting. Great, perfect. You want to reach out to him? Is that yours? Okay. So then the next is an update, and since neither, well, Alex, you got this one.
Yeah, so I think with the schedule working out the way it did, we don't have either of the students here tonight. The research portion of their project is coming along very nicely. I think I said at the last meeting, I'm very impressed with what they've been able to do. And we expect to hear from them at either the next board meeting or I believe they want to go at the next board meeting, because I think our June meeting is, we have, and we do have one who's a senior, so,
June is June 20th, they're out, she's out for that. June 20th, yeah.
So update is that the project is progressing nicely, and that we can expect a closeout report and should have adequate time on our May agenda for a closeout report.
yes.
And I'll ask you and Lisa to let me know before we send out agenda what we will need to block out for that report for the May agenda. Yes?
Yes.
Perfect. Okay. Next agenda item, which is way over budgeted on time, is COVID and flu updates. We, contrary to my expectation, we did not have a major flu outbreak this year. There was a minor flu outbreak, and there was in this part of the world and in this country, flu was not necessarily terribly highly morbid or mortal, although there was an article in JAMA that my poor aging brain, I can't remember whether it was out of Brazil or out of South Africa, and it was actually a well-constructed study that showed that in those countries, compared to the Omicron wave, the morbidity and mortality related to their flu outbreak was higher with flu than it was with the Omicron, as a case fatality, as case fatality rate, as a measure. And I raise that because if in fact we are in the endemicization phase of COVID, and I pray that we are, that remains to be seen. If we're not, we're going to find out fairly quickly because mitigation has virtually disappeared, looking at this meeting and looking at behaviors in general. So that's becomes really the most important parameter in evaluating, well, what is the status and what direction do things need to go. Personally, I still wear an N95 mask in circumstances where I don't know what the density of infection might be and where I don't know what the ventilation status might be or what my risk of exposure, but I'm nearly 70 years old, and if I were 45, I might be behaving the way most people out there are behaving. But I think we're going to struggle to get to what a new normal really looks like. And I had a conversation today, and I raised this because I think it's a really good point. I think that in bits and pieces, we've started to understand what the cost on a personal and social basis of the last 2 years has been, but I don't think that we have subsumed completely. So in the school boards, as much as I strongly believe that masks were really important in the schools for a long period of time, I also believe that they had a pretty significant cost. We don't know what that cost will be. We don't know what the cost of long COVID will be. We know that anxiety and depression and psychiatric issues have gone up by any way that you can measure those. And I don't know that we know what the societal cost is, but I think that's a place that we can perhaps be helpful and have leadership, because this was a pretty significant event. 1 million people dying over a 2-year period is a pretty significant event. And there's a societal cost to that, and there's a healing that has to occur, and a definition of a new normal. So I think we keep that as a regular agenda item and see if there aren't places where we as a board can be helpful to our community to move forward. Any other
Well,
comments on
Julie
that?
did have a presentation of all the web links.
I apologize for not seeing it, but
Yeah, right. So I'm not sure if they ever got put up, but she had a substantial list of where people can go get help if they're struggling.
And that's, I really apologize to Julie in her absence. I'm sorry I missed that, and I think that is the kind of thing, and very important on an individual and tactical, and I'd like to even see us get strategic in that regard. Other comments on that?
I'll just make a comment. I don't think we're really going to know what what actually is going to happen from an economic standpoint for years to come, especially when it comes to the school children and what they've been through, the kids that are in college now, the kids that are in high school, the kids that are in grammar school, and how their learning has been affected, and we won't know for years.
And not just their learning, their social development.
Absolutely.
I mean, not being able to see people's faces, it really may seem trivial, but it's not. It's not. Thank you. So we'll keep bringing that up as a topic, and I actually have a couple things that I'm about to work on that I hope will intersect there, and we'll see if there's anything that we can do there. So the action item, I think, there for the minutes is to keep that as an agenda item and keep our heads up and see if we can be helpful there. Any other comment? So that brings us to new business, and unfortunately, Maggie was another one of those who kind of got kneecapped by the schedule and was here she said early for a 5:30 meeting, but couldn't stay for a 6:30. But we'll get an update from the Board of Commissioners from Maggie at the next, and I'll ask her actually if there's anything that she wants to bring to our attention in the interim, so that we might be able to prepare offline before our next meeting. So I'll reach out to Maggie.
She did also, when we had the scheduling issue before, she did, I think you covered what she had under the follow-up for Kratom. I think that was pretty much her report.
Very good. So, and yeah, we'll more formalize that when she's in the room, which brings us to Jenny, who's been kind enough to take a minute to give us an update from the school district.
Sure. I can talk about two things, just very briefly. One of them is we had a legislative breakfast at our school district on April 7th. We invited some local representatives, Amanda Capelelli, Jennifer O'Mara, and Congresswoman Scanlon. We invited her. She was unable to attend, but she did send a staff member. And this breakfast, we had a couple of questions, or topics, I should say, to discuss. One of the topics was supporting student mental health, and that seemed to dominate most of the discussion during the breakfast. The other people invited were the district administrators, and we have student representatives that were there, along with our school board members. And we just got to meet and talk and really kind of let our legislative people understand some of the the constraints we've been under over these last couple of years with COVID, and just as you were talking about with the mental health of our community, our students, our staff, and just what it's been like, and just looking at the supports that are out there and how possibly the government can kind of help and maybe have some more supports. One of the things we discussed in length is the fact that even when students need help, there sometimes is a 6-month waiting period, and that's an awful long time if you're in a mental health situation. And it is something that everyone is very aware of, and it's something that we constantly work with in our school system. So it was a really great conversation. It was our 8th annual breakfast. I think we might have done it virtually last year. But it was nice because it was live again. So again, we're moving in the right direction. And also in stating moving in the right direction, we just concluded a week-long spring break. Today, the district decided to do a virtual day, and we provided that time virtually for any of our community to come in and be tested. So in our school at Radnor Middle School from 8:30 until 5:30 tonight, we had our nursing staff there that were providing COVID testing for anyone that wanted to do that. And we will resume our typical in-person classrooms tomorrow and work our way through the end of this school year. So that's kind of the report from Radnor Township School District.
I have a couple questions. What is the current testing program at the school district?
I don't know exactly what you mean by that.
Is there any required testing at all?
So if someone, and it's going to be talked about, I think it's tomorrow night, they're going to be re-looking at our health and safety plan and making some updates. So I don't really want to talk about what we were doing, but it will be broadcast about us looking at that. But yes, if students if they do test, they have the quarantine time. They can test day 3, day 5, wait till they're able to come back. When they are not being symptomatic and they're testing, they wear the masks, still masking on our buses. It's kind of an individualized type thing. We are not mandating masks. It's you wear a mask if you feel that that's what you want to do. And we are, last time I heard, it's about maybe 25% of the staff and the students are still masking, and the rest are not, unless, if they have cold symptoms, sometimes they will put a mask on. They will go down and be tested. We have plenty of tests. Our nurses are standing by, ready, willing, and able, as they have been for the last few years to take care of us.
If I understand, there's no compulsory testing, so if you do have cold symptoms, is there compulsory testing?
Not to my
No
knowledge,
compulsory
no.
testing.
No, but typically, students will, and everyone is being very thoughtful about, how they're feeling, and it's, as you all know, it's a very simple test, and pretty much all of our students have done it. I mean, the first time you do the nose swab with, a little guy like, 6 years old, it can be, traumatic. But it's amazing. Our students are getting very, it's kind of, fortunately, I'm not exactly sure, it's the norm, and people have been through it, so it's not the deal it was in the beginning.
How much positivity is there in testing at the school district?
It is on our website. We don't do contact tracing or anything like that anymore, but on our website, we did notice the numbers were sort of moving up. I don't know what it is right now, but we do take a look at that and following CDC and, when levels get to a certain point, what it is we're supposed to do. But I do know that they are going to be talking more extensively about this tomorrow at one of the committee meetings, and it will probably go on to a board meeting shortly thereafter,
Great.
the end of this month.
Thanks. Do you have any idea how much of a response there was to the voluntary testing today?
I think it was a really great response. I don't know that a lot of people showed up, not like we've had in the past, but it was there. And one of the reasons I believe they decided to do it was because a lot of our families do travel during this time, so they went, and had their spring break, which everyone, absolutely deserves to do that. But it gave everyone an opportunity to come back, take a breather, and have that testing opportunity, and we provide it. And of course, there's plenty of other places to get it as well. But we wanted to make sure we provided it for our staff and our families.
Well,
Sure.
Thank you for that. I want to go back to your students waiting for services for such a long period of time.
Yes.
Did the representatives have any ideas on how to shorten that wait time or any?
No.
I'm concerned that the students are struggling out there.
And they do realize it. They're well aware of it. We had breakout rooms or groups. So I was in the group with Amanda Capoletti, and one of the things that we really talked about was the fact that it's not only just the students.
Mm-hmm.
So the students go home to a family. So it really has to be a center-based, positive place for families to be able to go that need assistance. Because in a family, if one person is really struggling with mental health, be it a child, a student, child, or an adult, that family then has that whole piece. So
Absolutely.
it really does need to be family-based. As a school district, we have school counselors. We have clinical counselors that we do contract with that come in and really work with some of our more significant students. But we don't service families because, we're in the school. And it is, it's that whole unit that has to be well so the student can come in and really get the education that we want to be able to provide them. So one of the things we talked about was, money. It's always money.
Got it. Right, okay.
But money to open up more centers possibly. And again, like I said, definitely for students, but really looking at the family as a whole.
Okay, thank you.
Sure.
Can I just clarify about that? I get the same thing with the waiting for services. When you said they're waiting 6 months, what is it they're waiting 6 months for?
So they could be waiting 6 months to have counseling, like family-based counseling in their home. They could be waiting 6 months to have a therapist that is able and uses their insurance. It depends. But there is definite a bed being available. So if a student or a family member needs to be hospitalized, like in an inpatient, a lot of times there are no available beds at a certain time, and they have to wait because there's nowhere for them to be able to be, get taken care of. I mean, it is a crisis. It's a well-known thing, and even before COVID, there would be some wait times, but with COVID and with the increase in the anxiety and the depression and all the things that came with that, I would say a lot of this increase has to do with COVID. It could be other things as well, but I'm sure COVID is playing its piece in here.
So then it sounds like the 6-month wait doesn't have anything to do with school-based counseling.
No.
And then, so if a student goes into student counseling, can they get an appointment right away? Or do they have to wait for that? And how many counselors are there?
So in our schools, no, there really is no wait. We have plenty of ability to work with the students we have. But again, remember, we are a school, so we're not a licensed medical facility. We do provide counseling for the students. But again, we're not dealing with the family. And typically with counseling, it's the whole unit that has to be treated. Unit meaning the entire family. So that piece is what you're typically waiting for. In our schools, right now we have 5 school counselors. We have at the high school, I have 2 clinical health counselors. They are really a 1.4 person because one person comes 2 days a week and one's there every day. We have school psychologists. We have 3 social workers in our district. The middle school, same thing, 3 school counselors, a clinical licensed counselor, and 2 school psychologists. So we have a lot of staff, and we really are wrapping our arms around our students.
I think you bring up a really good point about the access to care, and it's really important, and it's really one of the faults of our health system today, is that, yes, the school district does a great job with the kids, but what about the families that the kids live in? And unless you have insurance, and many psychiatrists or psychologists don't take insurance, it's all cash-based. So it's really, a tiered system for mental health care these days, especially in certain pockets of the country. I'll tell you, in Colorado, it's basically you can walk in and you can get access anywhere you need for mental health. In Pennsylvania, it's a little tougher. In New York, it's even tougher than that. So it's a problem that we have, and it's something that we should try to work on for the future. Maybe not for this group, but it's certainly a problem.
So for me to get a better understanding, there appears to be an increase in demand. The major constraint is not at the level of the school district or within the township, but in the health system, and not necessarily the public health system, in the health system writ large. So is there a piece of this? So the other piece here is with the new county. What is the role of the county? And is there a piece of this where we, as the township, can have a role? It sounds like a big stinking mess, if you ask me. So I know I'm not adding any clarity, but is what I'm saying, is that what people understand as well? Okay. Thank you. Anybody else with comments? Okay. So the last agenda item on new business falls back to Alex on a discussion, the cryptic DST, which was daylight savings time.
Yeah, so this is something that I've seen some discussion about, both in the community and, of course, across the country right now, but within the community, and particularly with some of the school board members, and with some of the concern around this being particularly around the schools, that basically across the board from experts, there seems to be universal or near universal agreement that of the various options for dealing with the clock, the changing twice a year option is the worst option. Where there seems to have been some disagreement that has kind of been brought forth now that the US Senate has gone ahead and pushed for daylight savings time year-round, is that some experts have, a pretty sizable group, have come forward and said that really daylight standard time year-round is preferable to daylight savings time year-round. So they're kind of in agreement that changing twice a year is not good. Just for anyone who doesn't know, that it's like one of the deadliest or the deadliest days of the year in terms of like increases in car crashes and heart attacks and like all sorts of things that are not great. The concern about going to daylight savings time year-round versus daylight standard is that that means later daylight year-round, which means there's a longer portion of the year where students are would be going to school in the dark in the morning. And now, then again, there are also other experts that say, well, that's actually a good thing because then there's longer daylight hours later for them to play outside and do, outdoor activities if they're, doing things in places that don't have lighting for such things, or it's, it's warmer. So I mean, there are some things on both sides. In terms of the sleep piece of things, the sleep experts seem to be weighing more heavily on the daylight standard is better side of things. And I will say from, at least from the school board members that I have talked to, that seems to be the information that they've been getting as well, is that daylight standard year-round is really the better option versus daylight savings year-round in terms of children's health and children's sleep specifically. So it's, I wanted to bring it up as a discussion item here because I think it is relevant to what we do. I think there seems to be some conflicting evidence out there about whether the current proposed solution is really the best solution, even though everyone agrees on what the problem is. So this is something that I would encourage, people who are reading about this in the news and, looking at it to do some research about and get informed about. So I don't know if any additional work is going to come on this from the school board. It may be that if we really do go to daylight savings time year-round, then maybe we need to take a look at school start times again in response to that. But
Tony, do you want to make a comment?
so
Yeah, can you just clarify, is daylight savings what happens in the fall or what happens in the spring?
daylight savings is
What happens in the spring, when you add,
Spring forward.
when you add an hour to the standard clock was not daylight savings, the standard clock was the way it is from
I mean, I know Arizona and Hawaii don't practice the clock change. Have they got research from those two states that have been doing it forever?
Well, there's even differences there because those states are closer to the equator,
That's
so
true.
their sunlight doesn't change as much. And I mean, that gets into a whole thing of, should Indiana really be in the same time zone as Philadelphia? And I mean, that's a whole larger discussion. The piece of it that really would affect us at the local level is if the school board or if members of our local community decide that they want to lobby either the state or federal government one way or the other, or if the federal government does end up making this change, then does that mean at the local level that we need to take another look at school start times in response to that?
I guess the comment is we have to wait to see what the government does I mean, we can always render opinion, but we can't do anything on our own about it, correct?
No,
There's
our
some
board
rule
can-
that's crazy rule that,
Right, no,
Yeah.
our board and, no, we can't set our own time zone here in Radnor, and I don't think anyone wants to do that. No,
It would be
I
an
mean,
interesting experiment, though.
no, more my point in bringing it up was bringing the issue to people's attention that, for anybody who's, certainly, like I said, the evidence seems to be that it is a good thing overall to go to one time year-round versus switching twice a year, but that people may want to take a look into the effects on children's sleep and whether daylight standard may really be the better course to go, and if that's, something that you, again, not for this board to necessarily take up other than as a public information issue.
So this was an awareness issue. I would vouchsafe that if we took a poll here, if we decided that we weren't going to change, of the 7 people in the room, 4 would fall one way and 3 would fall the other. And my own sense is that it will not be actually schools that will drive where it actually ends. It'll be businesses. Because remember, the birds sing when they sing, and they sing driven by where the sun is in the sky, not by what the clocks say. Just, that's the biology of it. We already have a weird world. We already have a world where they change in Europe at a 6-week different interval, so that the cities in Europe are 5 hours ahead for 6 weeks and then go 6 hours ahead. And we have 3, actually, I think it's 3 states. There's Arizona, there's Indiana, and there's one other place that actually changes, but changes differently. So we just have to keep an eye on it and maybe have an idea of whether or not there is anything local that we might need to do. I would also add that the Senate passed the bill, but after it passed, there were dozens of senators who said they had no idea what they were voting for, and they would have gone the other way if they had known what they would vote for. And the Senate isn't the government. The Senate is half of the legislative branch, and so there's really not a law yet. It hasn't gone through the other House of Congress, nor has it crossed the desk of the president to become law or be pocket vetoed and veto overcome. So we do have some time here, and it's interesting, but again, I'll say, if we polled the 7 people in this room, I'll bet you it would be 4-3 one way or the other. All righty. With that, I think we've finished our agenda, and we have public participation. There's no Zoom, so if nobody in the room is here for public participation, I'm going to give a...
I'm going to bring up one other
go ahead.
issue, the oral health issue for the school district. So I didn't get a chance to meet with you, Jen, about that. But in the meantime, I've been working with, and I'll just bring it up to the board to see if this is something of interest. I've been working with Colgate, and they have a van that goes around the country, several vans that go around the country. And we're going to bring the van to Jefferson sometime this spring. And I was wondering if this might be an idea of bringing the van maybe on a Saturday to the parking lot here and opening it up for oral health education for anyone who wants to come. Basically have a bunch of dentists here, give out toothbrush, do oral hygiene instructions, and something fun.
I love it.
Lots of giveaways.
I love it
I
too.
vote on it.
Well, so the question is, what will we need to
What do
do
you
to
need?
enable it? If you have the clout to bring it here, the question is whose permission would be required?
I guess
in order
because
to do
it's
that?
Colgate and there's a name associated with it, is there any objection from the
Right.
township?
Well, well, let me ask you to just craft an email to, I guess we would ask Maura and Bill, Bill White and Maura, if we could make it possible. Is there anything that would need to be done at the level of the professional or elected township leadership to allow this to happen?
Or would the school be interested?
Or that's, well, I was going to work separately with the school.
Oh, okay,
But this
all right,
was
got
just
it.
something that we were working on anyway, and
Okay.
I thought this would be a great idea to bring here maybe on a Saturday and just have lots of people participate. Give away free
I'm all for it.
toothbrushes and floss,
So I think we should inform Maura and Bill.
Okay.
And go ahead and see if there's anything that we would need to do, and in the meanwhile, work to enable that. I think it's a great idea.
Okay.
So that was another new business item, kind of. Anything else then? Can I have a motion to adjourn?
Motion to adjourn.
A second?
Second.
All in favor?
Aye.
All righty, here we go. Our meeting is adjourned.